Rajeshri, you are audible. Please start.
Okay, ma'am. Yeah. A very good evening, everyone. I feel extremely glad to welcome everyone on this much awaited webinar of this webinar series by NIMA-OBGY Central. I am Dr. Rajeshri Shelare, coordinating today's webinar with Dr. Brunali Gharpure. Before starting our session, I request all the dignitaries and all the participants to take a moment for the blessing of Lord Dhanvantari. Namami Dhanvantarmadidevam Surasure Vandita Padpadmam Loke Jararuk Bhayamrutyunashanam Dataramisham Vividhaushadhinam. So, Lord Dhanvantari blesses all with the good health, success and happiness. Let us continue and begin this webinar. On the behalf of NIMA-OBGY Central, I welcome to all dignitaries and delegates for today's knowledge enhancing session on the topic of Ayurvedic protocol in normal labor. First of all, I welcome Dr. Ashutosh Kulkarni sir, President, NIMA Central, Dr. U.S. Pandey sir, Secretary, NIMA Central, Dr. Shantilal Sharma sir, Treasurer, NIMA Central. Then, I would like to welcome Dr. Kamini Dhiman Madam, President, NIMA-OBGY, Dr. Priyanka Nakade Madam, Secretary, NIMA-OBGY Central, Dr. Vishnu Bhavne sir, Treasurer, NIMA-OBGY Central, Dr. Rajesh Utane sir, Convener, NIMA-OBGY Central. I would also like to welcome Dr. Suhash Harlekar sir, President of NIMA-OBGY Maharashtra, Dr. Manoj Gaikwad sir, Secretary, NIMA-OBGY Maharashtra, Dr. Ajay Raj Bal sir, Treasurer, NIMA-OBGY Maharashtra. So, before we go any further, let me give you a few instructions that are common.
Dr. Rajeshri.
Dr. Umesh, see for the network issue, if she is having, she is not audible.
I think she's not audible.
Brunali, please carry on.
Please carry on. Dr. Munali.
Sorry for network issues.
Dr.
There is-
Raj, please
Yes,
check.
there is- Yeah, ma'am. So before, let us continue. So before we go any further, let me give you a few instructions that are common for all participants. Please keep mute yourself during session.
Wi-Fi लाव रे. तिकडे ते बटन तेवढं ऑन कर. हा, आणि हे फक्त जरा गरम करून दे.
Rajeshri, are you there?
Dr. Rajeshri, you are not audible.
Okay. Am I audible now, ma'am?
Yes,
Yeah.
please.
Okay, sorry for interruption. Now I would like to brief everyone here about NIMA-OBGY agenda. NIMA-OBGY, that is National Integrated Medical Association, Obstetrics and Gynecological Society of India, aims to impart education in supporting and protecting the character, status and interest of integrated medical profession in general practitioner of Stri Rog and Prasuti Tantra, that is integrated obstetrics and gynecology, including human reproduction, family welfare, study and research in the field of contraception and other allied problems. NIMA-OBGY is committed to promote services for the betterment and health of the community, especially maternal and child health, prevention of ailments and disease. The treatment with integrated approach, Indian medicine with modern science. So with this, let us continue with the what we have come today with you, our knowledgeable webinar in this series. So dear, all of you know today's topic is Ayurvedic protocol in normal labor. In women's life, motherhood is a crowning act. Every woman tries to enter in this new world of mother with minimal pain, operative aids, and complication, as childbearing and delivery are the physiological phenomena, and any abnormality in the course of labor can affect women's health. So only for that time, but also through her life. That's why our Acharya have given specific importance to the Garbhini and described details about the mechanism and management of labor for bringing good health of mother and baby also. That is Sukha Prasav. So we are here to explore what Ayurveda has to say about protocols of normal labor. Today, we are very lucky to have you here with us, eminent speaker, Dr. Soni Kapil Madam. She will guide us through her novel thoughts regarding the topic. So we welcome you, Madam. We are honored to have you with us. It is my pleasure to introduce all of you to Dr. Soni Kapil Madam. Madam is working as an associate professor at PG Department of Prasuti Tantra, Evan Sri Roga at RGGPG Ayurvedic College, Paprola. She has also done BMS MS from HPU Shimla and PhD from Avdesh Pratap Singh University. Madam has 24 years of clinical experience. Madam has published one book and 43 research papers and guided 40 PG theses and presented papers in various international conferences. Madam is a member of Medical Board of UG, PG and nodal officer at JSSK PG College, Paprola. Madam has special interest in the field of infertility, ANC, PNC and PCOS. So with due respect, I would like to call upon Dr. Soni Kapil Madam to start a session on today's topic. Over to you, Dr. Soni Kapil Madam.
Thank you, Dr. Rajeshri.
Thank you.
At first, I want to thank the office bearers of NIMA Central, especially Kulkarni sir, and office bearers of NIMA OBGY, President respected Kamini Dhiman ma'am, and Priyanka ma'am, and Vishnu Bhavani sir, and to the office bearers of Maharashtra unit of the NIMA OBGY for providing me this nice opportunity to interact with the great audience on a very burning topic, that is Ayurvedic protocols in the normal labor. So I am going to start my topic, and in this topic I will discuss about the Ayurvedic, what Ayurvedic literature says about the prasav and its modern correlation. It is still relevant in today's words about the labor. So let us start the topic. So what is prasav? It is very beautifully explained in Ayurvedic text by a shloka, kalasya parinamen muktam vrintadhyatha phalam prapadyate swabhaven na anyatha patitum dhruvam evam kal prakarshen mukto nadi nibandhanat garbhashasthu yo garbho jananai prapadyate. So this is the definition along with the causes of onset of labor that is beautifully mentioned in a sutra roop in the Ayurvedic text. And prasav is the expulsion of fetus due to the action of prasuti marut, according to the definition at the proper kala. Sacha upasthit kale janmani prasuti marut yogat parivritya avakshira nishkramatya apatya pathin esha prakriti. So that is mentioned. So here the prasuti marut is mentioned, and the garb nishkraman is the action of apan vayu. So a specific name, by considering its special action in the labor or in the prasav, the name is given prasuti marut, and that is just a apan vayu, because it is just synonym used here just to emphasize the action of apan vayu in the labor or in the prasav. So expulsion of fetus due to the action of prasuti marut at the proper kal, that is the definition of prasav in Ayurvedic text. And prasav word is made up of two things, pra and su. So pra refers to the forward movement and su refers to the passage or pass. So it's very authentic word. And labor, according to modern literature, everyone knows, series of events that takes place in the genital organ in an effort to expel the viable products of conception out of the womb through the vagina into the outer world. So that is just as equal to the that is mentioned in the Ayurvedic text. So criteria of Samanya Prasav. According to the modern literature, we call it a normal labor when there is spontaneous onset, spontaneous expulsion of a single live mature fetus with vertex presentation through the birth canal within a reasonable time, not less than 3 hours or more than 18 hours, and without any undue complications to the mother of the fetus. So in Ayurvedic literature, it is mentioned by the Charak Sanhitakar in a very beautiful shlok, Shukr Asrik Atma Ashe Kal Sampat Yasya Upcharash Hitais Tatha Anneh Garbhascha Kale Cha Sukhi Sukham Cha Sanjayate Paripurna Deha. So Shukr Asri means the good ovum, good quality ovum and sperm without any bij dosh. Here they put emphasis on the healthy progeny also. If any abnormality or any anomaly is there, then we cannot call it as Samanya Prasav. So Sukh Asrik Sampat means fertilization of good ovum and sperm without any bij dosh. So Ashe Sampat means normal shape of uterus that leads to the normal labor without any pathology like fibroid uterus or any septate uterus or a biconjugate uterus. That kind of pathology should not be, or any congenital abnormality should not be there in the uterus. Atam Sampat, that is Shukr Shonit Jeev Sangyoge Tu Khalu Kukshi Gate Garbh Sangya Bhavati. So that is in Ayurvedic text, it is mentioned after fertilization of the ovum, the sanyog of jeev is very much important. If it is not there, then that is not conception is not going to flourish. So Atma Sampat is very much important, and some paripurna deha after the getting nutrition from the hitkar ahar vihar of the mother, when it attains maturity. So and when the proper kal comes, or when that is kal sampat, when the fetus become full term and when it delivers, then it is Samanya Prasav. Samanya Prasav kal, it is mentioned differently by different acharyas. In Charak Sanhitakar mentioned Tasmin ek divasa atikrante api navamam masam upadaya. Means even after the passage of 1 day in the 9th month, that is the proper kal for the Samanya Prasav. So 9th month and 10th month, that 2 months are mentioned by the Acharya Charak. And Sushru Sanhitakar mentioned Navam Dasham Ekadash Dwadashanam Manyatam. So starting from the 9th month up to the 1 year, up to the 12th month, that is the normal period according to the Acharya Sushrut in Bhagavad. Kashyap mentioned Navam Adishu Masishu. 9th and 10th month are mentioned by the Kashyapa. So we cannot make any congruence between this kal, that is the duration of or gestational age at which the fetus delivers. We cannot make congruence according to the present context, because at that time Chandramas was considered for the calculation of the months in the gestation, and the Chandramas is of 28 days. So that may be the reason that up to the 1 year, that is the normal duration or intrauterine stay of the fetus. That may be the reason, and a lot of reasons are there. So we cannot make congruence with the modern time. But according to modern, 37 to 42 weeks of gestational age, if the labor onset is there in between that period, so that is the normal or Samanya Prasav kal. So based on the Neagle's formula, it 80 days, as everyone knows, but there is great variations. Only 4% fetus delivers on the expected date, and 50% 1 week on either side, and 80% 2 weeks earlier and 1 week after, or 10% at 42 weeks and 1% after 43 weeks. You can see it very clearly that the duration of gestational, the gestational age at which the fetus delivered, that is not fixed even in the modern scenario. And we get only 1% on 43 weeks plus gestational age the labor onset is, if it is there, that is not there, that the percentage is very much less just because of the lot of induction techniques now available nowadays. So we can say that at that time, that methods were not available, that kind of strong drugs like oxytocin and other prostaglandins are not available in a extract form. That's why that period is prolonged, because the obstetrician at that time or Vaidya at that time waits for the normal onset of labor. So causes of onset of labor, I have already explained all the causes like Kal Prakarshata, Swabhav, Nadi Nibandh, Muktata. And that is mentioned by Sushruta Samhitakar as Kalasya Parnamin Muktam Grintadeda Phalam. In that shloka, it is very beautifully mentioned for the causes of onset of labor. But Harit Samhitakar mentioned Garbhavas Vairagya. So, Jaite Tasya Vairagyam Garbhasasya Karana. That is mentioned by Harit Samhitakar. And Bhel Samhitakar mentioned Sampurna Gatro Bhavati Yada Saras Bhavita Tada Prasotya Akasham Garbha Sri Kukshi Vichuti. So Sampurna Gatrata or full maturity is the reason behind the onset of labor. According to the modern concept, uterine distension, fetal-placental contribution, estrogen, progesterone, prostaglandins, oxytocin, neurological factors, now we can detect a specific etiology. Still, the etiology of onset of labor is obscure, even in the modern era, because that is mentioned in all the textbooks. But these are the theories, or these are the observations that the action of these hormones and action of these factors leads to the onset of labor. Now, this is the parturition cascade according to the modern literature. At full term, the fetal hypothalamus secretes corticotropin releasing hormone. It acts on the fetal pituitary and further releases adrenocorticotropic hormone that acts on the fetal adrenal and enhances the production of cortisol. In fetal liver, there is DHEA as dehydroepiandrosterone that is secreted, and that both these hormones going to increase the production of estrogen from the placenta. There is increased production of oxytocin, prostaglandins, estrogen, progesterone, and interleukins 1, 6, 8. Though the progesterone production is decreased due to the presence of the DIs, because it hindered the steps of conversion of pregnenolone into progesterone. So progesterone production is decreased, but there is enhanced production of estrogen at term because of the excess cortisol, and that cortisol also comes from the pituitary of the mother, because there is stimulation of hypothalamus and secretion that acts on the posterior pituitary just because of the increased production of estrogen. So there is from the posterior pituitary, another thing is that is oxytocin is released, and that increases the myometrial receptors for the PGs and oxytocin, and increases the gap junction, increases decidual PG-F2 alpha, and increases stress receptor and increase the number of sensitivity. So that all things leads to uterine contraction, and there is labor, onset of labor. That is the parturition cascade. So probable mechanism in initiation of labor is that is still unknown. So activation of fetal hypothalamic pituitary adrenal axis at the full maturity of the fetus that causes increased production of cortisol, and that acts on the placenta and enhances the production of estrogen, but decreases the progesterone production. So that is the altered balance between the estrogen and progesterone that leads to the acts on the maternal posterior pituitary, and pituitary releases oxytocin, and that is going to act on the placenta, amnion, chorion, and decidua, and that altered balance is directly affecting the placenta, amnion, chorion, and decidua, and there is increased production of oxytocin, PGs, and contraction associated proteins, nitric oxides. So everything leads to the activation of myometrial contractile system. Now the estrogen, how estrogen initiates the labor. It increases the release of oxytocin, promotes the synthesis of myometrial receptors for oxytocin. Receptors increases 100 to 200 folds at term and at the time of the initiation of labor. Prostaglandins and increase in gap junction in myometrial cells. It accelerates lysosomal disintegration in the decidual and amnion cells, resulting in increased prostaglandin synthesis. It stimulates the synthesis of myometrial contractile protein actomycin through cyclic AMP generation. It increases the excitability of myometrial cell membranes. So progesterone increased fetal production of, as I have already told you, the dehydroepiandrosterone sulfate and cortisol inhibits the conversion of fetal pregnenolone to progesterone. So progesterone level therefore falls before labor. And this is the alteration in the estrogen-progesterone ratio that is the reason behind the onset of labor, and not the absolute fall in concentration of the progesterone. So which link to the prostaglandin synthesis. Another factor that acts like neurological factor, both alpha and beta adrenergic receptors are present in the myometrium. Estrogen acts on the alpha receptors, that is going to relax the myometrium, and it causes decrease in CAMP, and the beta receptor that is going to excite the myometrium. And beta receptors are acted by the progesterone, and that relaxes the myometrium. So due to the alteration in the, or the excess of the estrogen, there is initiation of the contractions in the uterus. So contractile system of myometrium is, there is production of prostaglandins that diffuses into the myometrium, act on the sarcoplasmic reticulum. So at that cellular level, there is decrease in the cyclic AMP. So that decrease in CAMP causes increase in free calcium ion that is secreted in the from the storage places like say sarcoplasmic reticulum, and maybe due to the intracellular influx from the outer side. So that make the calcium calmodulin complex that act on the MLCK and initiate cause phosphorylation of the MLCK and causes uterine contraction. So Kal Prakarsh, according to Ayurveda, Kal Prakarsh or Kal Parinam or Kal Sampat. So here the human fetus is equated with the fruit. When the fruit attains maturity, it detaches from its stalk. That is called Kal Prakarshan, and it comes down naturally. So the garb is equated with that mature fetus. So when the garb at appropriate time attains maturity, it gets detached from the Nadi Niban. Here Nadi is the umbilical cord that is attached to the placenta, and from placenta the fetus is attached to the Matra Hirdayat according to the Ayurvedic concept, because it gets blood supply and nutrients from that placenta. And then it proceeds to the prasav due to the swabhav also. So after a specific period of gestation, there are changes necessary for prasav that occur that causes initiation of labor. So what is the reason according to the modern? We can equate it with the modern also, because in modern text it is written that the senile condition of placenta, there are change in the nutritional pattern which causes fetal neuroendocrinology triggering the labor procedure, which I have explained previously. So fetus, after appropriate growth and maturation of vital organs, provide the initial signal, and that triggers the process of labor. Fetal cortisol theory I have explained in details. So there is increased cortisol production from the fetal adrenal gland before labor that may influence its onset by increasing estrogen production from placenta. So fetal placental contribution is explained diagrammatically. So prior to the onset of labor, there is CRH increase. That increases ACTH, and fetal adrenal increased cortisol. So there is increased production of estrogen and prostaglandin from the placenta that initiates labor. So maternal CRH, maternal hypothalamus also releases CRH that acts on the maternal pituitary, and from there ACTH acts on adrenal gland, and maternal production of cortisol is also increased. And due to the excess of cortisol production from the maternal side and the fetal side, that is going to initiate the process of labor. So Mukta Nadi Nibandh, that is the another reason mentioned in the Ayurvedic text. Mukta means getting free. So Nadi word, I have already told you, it is described for the umbilical cord and for the motor nerve fibrils also. So release of or detachment of Nibandh means the release of obstruction in their normal functions or detachment of attachments. So due to the senile changes in placenta, there is calcification in placenta at term, and due to the neurological factors that lead to the onset of labor. So umbilical cord derives its nourishment from placenta, to which it is attached. As the term approaches, infarcts appear at the maternal side of placenta, which hamper free flow of oxygen, causing anoxia to the fetus. That leads to the onset of labor. In other words, attachment situated in between the umbilical cord. Umbilical cord is also explained as Rasvahi Nadi in the Ayurvedic text, or placenta, the maternal body or uterus are detached and which initiate labor. Another thing is oxytocinase enzyme that is secreted by placenta during the gestational period that inhibits the action of oxytocin during pregnancy. This enzyme inhibits the myometrial oxytocin receptor stimulation. So as preceding placental maturity, this oxytocin secretion decreases or stop, allowing the oxytocin to act. Thus, obstruction in function of nerves that is mentioned in the Ayurvedic text, that is released, we can say. So Swabhav is the Sahaj Gun or reserve or inherent nature of the matter. So how we can explain that Swabhav theory? Because hypothalamus and CNS is the regulator of diurnal nocturnal rhythms, we all know, which monitors different cycles like sleep cycle, awake cycle, respiratory rhythm, cardiac rhythm. All the functions are controlled by the hypothalamus. So the gestation and the parturition, that is also a physiology that is also controlled by the hypothalamus, and that is the Swabhav, or we can say we cannot give any reason for the physiology. That is the Swabhav that is made by the God, and the physiological changes occur simultaneously, regularly in the body at the time to time. So that is explained by the word Swabhav. So Garpas Vairagya is mentioned by the Harith Sentakar. So Vairagya means, as we all know, aversion to a particular matter. So at the term, fetus is getting averted due to intrauterine state, just because of the anoxia created by the decreased blood supply to the placenta, just because of the formation of infarcts or calcification at the term or near term, or to come out from it and cause for initiation of labor, as told by the Harith. So the key component for the onset of labor appears to be the fetal brain, whose influence is exerted on the fetal placental endocrinology by hypothalamus pituitary adrenoplacental axis. So the fetus itself is responsible for the onset of labor, and that is called Garbhas Vairagya. Gatra Sampurnta can be explained like when there is Sampurnta of all the Angavya, when the all fetus is fully mature or attained maturity. So the initiation of term labor is carefully timed to begin only after the embryo is sufficiently mature to survive ex utero. So that is described by Bhel as Gatra Sampurnata. So it can also be correlated with the stretching effect and also activation of fetal HP axis or fetoplacental. All the things can be explained. So now coming to the different stages of the labor. The stages of labor are not well defined in Ayurvedic text as per the modern literature or modern concept. So we can equate it with the different stages in the modern context, because if we have to manage it by following certain modern guidelines, then we should equate it with the Ayurvedic concept. So stage of pre-labor that is mentioned in modern text, that can be explained as Prajayani Lakshan, mentioned by Sushruta Sahitakar, or Upasthit as Prajayani Lakshan, or Prasvotsuka Lakshan. And the word Prasvotsuka is mentioned by Mahaprakash. So first stage of labor is can be explained by Asan Prasava Lakshan, mentioned by Charan. The second stage by Upasthit Prasava, mentioned by Sushrut, that is the second stage, or sometimes we can correlate it with the end of the first stage also. So third stage of labor can be equated with the reference that is mentioned for the Apara Patan. Fourth stage is the stage of observation, that can be mentioned by the early care in the or Sutika Paricharya in the early day, just after the delivery of the fetus. So Prajayani, that is mentioned as a pre-labor stage. It begins 2 to 3 weeks before the onset of labor, pre-labor stage, according to the modern text. So here it is mentioned, Jate hi shithale kuksho mukte hirde bandhani, sashuli jagne nari giya satu Prajayani. So shithilta of kukshi, that is the looseness in the abdomen, flanks, or the cervical changes can be equated with that. And there is relaxation of ligaments and joints under the influence of relaxin hormone. So that is the shithilta of Kukshi. And Mukta Hirday Bandhan, that is relief of pressure over the chest. That is the relief from the cardiorespiratory embarrassment as felt by the woman in the later half of the pregnancy because of the pressure of the growing fetus on the chest. So when there is engagement or dipping of the fetal presenting part into the pelvis, so that pressure is relieved and that can be equated with that. So mukta means getting free. So it may be correlated with ligament lightening. So all these changes may be correlated with all lightening effect, relaxation of ligaments and joints, and cervical softening. That are the signs of pre-labor. So lightening is due to the active pulling up of the lower pole of the uterus around the presenting part. So here the presenting part sinks into the true pelvis, and it diminishes the fundal height and pressure on the diaphragm. So that leads to the lightening. Now, cervical changes. The period is prior to the onset of labor, cervix become dry. So collagenase hormone activate and it break down the collagen of the cervix, and there is a ripening, or the cervix becomes soft and 80% effaced in primigravida. In multigravida, effacement and dilatation both occur in the first stage simultaneously. So cervix is less than 1.5 centimeter in length. It admits one finger easily. It is easily dilatable. Along with there is relaxation of ligaments and joints. These are the welcome signs, we can say, the pre-labor welcome sign. Jaganshul, pain in hip. Appearance of false pains can be correlated with the Jaganshul. It is usually found in the primigravida, then in the Peyer's woman. So it usually appears prior to the onset of 2 labor pains, by 1 or 2 weeks in primigravida and few days in multipara. And such pains are probably due to the stitching of the cervix and lower uterine segment with consequent irritation of the neighboring ganglia due to the fetal head. So due to the engagement of the fetal head, or when there is just dipping of the, or then fixation of the head into the pelvis. So that kind of changes occur, and appearance of false pain is there, or that is easily relieved by giving antispasmodic. Sometimes the gastric distension also is mentioned as the cause of the this false pains. So when we give NIMA, that distension disappears, and that is the sign that these pains are false pains. So upasthit prasava, according to Sushruta Samhitakar, that can be correlated with the second stage. Tatra upasthit prasavaya kati prishtham prati samantad vedana bhavitya bhikshnam parish pravritti mutram prasichite yoni mukhat shleshma cha. So upasthit prasava denotes at hand, just going to deliver, we can say. The name denotes that. So here the kati prishtham prati samantad vedana means there is severe pain around the back and sacrum. So there is enhancement of uterine contractions, we can say. And purish pravritti mutram prasichite, that is, as the head descends down, it descends the perineum adjoining anal sphincter, is stretched and stool comes out during the contraction. As the head descends down, the bladder, which remains a pelvic organ throughout the first stage, becomes abdominal organ. Nipping of the urethra in between the fetal head and the pubic symphysis is there, and there is incontinence of urine with the labor pain. So that are the changes of the second stage of labor. So Prasposukha is also used synonymously because this is the name given to by the Bhav Prakash to this stage. So Asan Prasva, that is the first stage of the labor. So Tasyastu khalamani lingani prajanan kalam abhimatu bhavanti tadyatha klamu gatranam glanirananasya akshanam shathilyam विमुक्त बंधनत्वम एक वक्षसा कुक्षीर अपसंस्रणम अधो गुरुत्वम वंशन बस्ती कुटी कटी कुक्षी पाश कृष्ण स्तोदा योनि प्रस्रवणम अन्नन अभिलाषश्चेति ततो अनंतरम आविनाम प्रादुर्भाव प्रसेकश्च गर्भोदुकस. So these are the symptoms that shows the onset of 2 labor pains and ends with the full dilatation of the cervix. So with the, in other words, that is the cervical stage of labor. We can correlate it with the cervical stage, and its average duration is 12 hours in primigravida and 6 hours in multipara, as we all know. So it is divided into 2 phases, latent phase and active phase. So what we can understand with these symptoms, so, Klamogatrana means the woman feels exhausted. Glanirananasya, her face becomes languid. Akshnoshathilium, eyes becomes lax, just because of the ongoing uterine contractions or the labor pains. Vimukta bandhanam vipaksha, she feels as if it bonds of the chest are released, because as the fetal head sinks into the pelvis or the presenting part sinks into the pelvis, that leads to the release of bond from the chest. Kukshir absansram, just falling of the fundal height. Adhogurutva, that is heaviness in the lower abdomen because of the entry of the fetal presenting part into the pelvis. Function basti kati kukshi parsha prishta nistoda, that is the pain in groin, bladder, sacral region, flanks and backs. Yoni prasravana, discharges from the vagina due to the dilatation of the cervix. Ananabhilasha, anorexia, lack of appetite. Tato anantram avinam pradurva, means avi here refers to the true labor pains. Prasekach garbodas, rupture of bag of membranes along with the excretion of liquor. One thing that is yoni mukh shlesham prasekam, discharges PV. According to Kashyap Samhitakar, a yoni prasransaram odare. So odare is mentioned, that signifies yoni prasransaram odare, dilatation of the cervix. The prasransaram means leakage of amnion. So that is in first stage of labor. And in second stage, it starts with the full dilatation of cervix and ends with the expulsion of fetus with from the birth canal. Its average duration is 2 hours in primigravida, 30 minutes in multipara. It is divided into 2 phases, propulsive phase and expulsive phase. When the head reaches the zero station or at the level of the ischial spines, and along with the descent, there is a maternal bearing down effort that appears. So that is the expulsive phase. Another thing that is mentioned is the parivartit garbha or abhagar. That kind of terminology is used in Ayurvedic text. That signifies the last phase of second stage of labor, when there is internal rotation. So what is written in Ayurvedic text, that is yada janiyat vimuch hirdayam udramasya astab vishati basti shiro abgrinhati tav antarya avyam parivartate adhu garbha iti asyam avasthayam paryankamin aropya pravahitum upramit. So when the fetus descends further or is going to be expelled, that is called parivartit. So vimuchya hirdayam udram astita savishati, means leaves hirdaya and enters and descends into the lower abdomen. Basti shiro abgranati, catches or stays at the region of neck of bladder. It reaches up to the bladder. Tvarantyam avya means increased frequency and duration of labor pains. And parivartit garb or abhagar means that signifies the internal rotation of head that occurred in the last phase of the second stage of labor, when the head reaches up to the ischial spines or crosses the ischial spines or zero station. So it can be correlated with internal rotation of head, or descent is continuous process, and after internal rotation at the level of ischial spine, fetal head further descends, and there is delivery of the head. Kashyap also mentioned the same kind of features as mentioned with other acharyas like Muglani, Klamu Anganam, Akshi Bandhan Muktata, Kupshir Samsrantam, Adhoparatvam, Yoni Prastravadam, Parshu Prisht Kati Vangshanati Tudyate, Bhakta Dvesh or Klam. And for the Parivartit Garbodakam, Yono Sashulam Sampravartati. Means Vimuchi Hirdya Mudram, Basti Shirsha Madhu Bhagam Abhnanati, Glani, Yoni Utpidan, Bhedanam. Means there is increase in the labor pains or the intensity and duration of the labor pains or uterine contractions. So that is enhancement of the pain that is mentioned by all the acharyas. The third stage is aprapatan. That is the stage of labor where third stage where after commences with the expulsion of the placenta. So after delivery of the fetus, apra gets detached from the matra hirdya. For that, Ayurvedic references are there. Evam jatrastu garbo janma kale shu tu prasuti marut yogat parivritya vakshira nishkramatya anu apra-chuta matri hirdya. That is mentioned by Ashtang Sangrahakar. So apra, expulsion of apra is mentioned in this shlok. Yada cha prajata syat tadev nave ikshete kada kachit asya apara aprapanna na veti. So this is the reference mentioned by the Charak Samhitakar. So usko bola hai ki we can monitor the female or the pregnant female until there is expulsion of the placenta. That is mentioned by the Charak Samhitakar. And Kashyap Samhitakar mentioned the definition of Sutika Sutayaschapi Tatra Syad Aprachenna Nirgata Prasuta Pina Suta Istri Bhavativam Gati Sadgati Sati. Until there is expulsion of placenta, we cannot consider the woman as Sutika or in Purpurium period. So after the expulsion of placenta, we can call her as Sutika. So expulsion of placenta is mentioned in this way in the Ayurvedic text. So by action of Prasuti Marat, in a similar way of fetal expulsion, placenta also expelled out. It begins after expulsion of fetus and ends with the expulsion of placenta and membranes, that is after birth. And its average duration is about 15 minutes in both gynae and OT. And by active management, it is 5 minutes. So what is beautifully mentioned in Ayurvedic text, that is the Sutika Gar. So in that time, special Sutika Gar or special place for the labor or delivery is constructed before the onset of labor, and the woman is shifted to that place for the conduction of labor along with birth attendants or dyes. So that kind of practice was there at that time, because the aseptic measures as available in the modern era, that kind of measures were not available at that time. So to maintain the asepsis and prepare the patient psychologically for the process of labor, the special houses made up of wood were constructed at that time to, and the woman is shifted to that houses for the process of labor along with all the amenities that were required at that time for the conduction of labor. So Prak Chevasya Naman Manmasat. So that kind of the Sutika Gar were constructed before the 9th month of pregnancy. So it would be separately constructed for every Sutika, and these are usually dismantled after her discharge. This would take into account the separate need for every individual, and at the same time would focus on providing clean, healthy, sterile condition to every mother. So why wood was used at the time to construct these houses? Because of the easy availability, protection from thunderbolt, because wood is bad conductor of electricity, and these kind of Sutika Gar were easy to dismantle. So places of Sutika Gar, that should be Prashast Ruparas Gandhayam. That should having the properties of good earth, we can say. So we cannot construct a Sutika Gar at a garbage place just by cleaning the garbage from that area. So clean land was selected for that, for the construction of the Sutika Gar. So Prak Dwaram, Udak Dwaram, that the entry of that house or that Sutika Gar was east facing or north facing, according to Charak Samhitakar or Vakan. And Pragdwaram, Dakshin Dwaram, that was mentioned by the Sushru Samhitakar, the east or south facing. So all the acharyas except Sushru Samhitakar mentioned the Pragdwaram, the east or north facing houses. So it is made for the entry of sun rays and for the proper flow of the Vayu. So dimension, what was mentioned? Ashta Hastayam Chatur Hast Vistrita. The ward should be 12 feet long and 6 feet wide. I think that should be of the dimension of the labor room. But all other rooms were also constructed, because along with the parturient female, the other birth attendants also stayed at the time with her. So a proper house made up of wood was constructed, that was called Sutika Gar. So Navame Mase Punyahani Prashast Nakshatra Yogam Ukkate Prashaste Matre Muhurte. So she was advised to take advised to enter into that Sutika Gar in a Shubh Muhurat, or that is Matre Muhurat, in Prashast Nakshatra, in good Nakshatra, she should enter in that Sutika Gar. And along with that, as the Prasuti Marut or the Apan Vayu Anuloma is required at the time of near the labor, because that leads to the expulsion of the fetus, and for the preserved Anuloma, Apan Vayu is responsible. So she was advised to take Anuloma, Nahar and Bihar and Palvarti in case of Vat Vibandhan. So what material needed? The Bilvanam, Kashanam, Tendukam, Ingudakanam, Bhalatakanam, Varunanam, Khadrinanam Va, Yani Chanyanapi, Brahmana, Shansher, Athar Ved Vidaste Sham. So Bilva Kast, Tinduk, Ingudi, and Bhalatak or Varun. These trees were used for getting wood for construction of the Sutika Ghar. So why these trees were selected? So all plants have aromatic effect and also found volatile properties. And most common property of all is that they are having cribbing property and furniture made up by the same wood. So above wood have long durability. So what kind of the material is required in Sutika Ghar? To that is what is required for the normal delivery, that all the amenities were accumulated in that Sutika Ghar before the onset of labor. So 2 pieces of stones for pran pratyagamanan of neonate, 2 pestles, 2 mortars for crushing and grinding of the drugs, 2 needles made up of gold or silver, sharp instruments made up of iron, madhu, grit, sandhak, tel, etc. All these things were collected there. So drugs were also collected in the Sutika Ghar. A lot of drugs were mentioned, but I described it according to the action. So in Garbsang Chikitsa, Gurjpatra, Kusht, Balbaj, Mandu, Parni, Suraman, Chavya, Chitra, Pipli, Vacha, Chirbal. These were accumulated. For Aprasang Chikitsa, Langali, Hoot, Balbaj, Gurj, etc. For Deepni, dravyas are also required. Shont, Pipli, Pipli Moon, Chavya, Chitra, Hingu, Ela, Pidang, Lashun. And for the Sutika Paricharya also, some of these drugs are used because at the time Agni is Mandya, so that's why the Deepni dravyas are required at that time also. So Vatanuloman, for Vatanuloman, Hingu, Kusht, Devdaru, Shunthi, Ela, Vacha, Sarshap, Lashun, Atsi, Kulat. For Shul Prashaman, Pipli Moon, Ela, Sarshap, Lashun, Kadam, Shunthi. Shotha drugs sometimes required. Kulat, Kadam, Lashun, Sarshap, Manduk, Parni, Shunthi. Stanne Shodhan and Stanne Janan after the delivery of the fetus. So Bhurj, Atsi, Manduk, Parni, Devdaru. Kankanika is specifically mentioned in Ayurvedic literature. So according to Chakrapani, Tika, the Kanika is the stool tandul and Kankanika means the broken rice. So Sura, Asaf, Stanijanan, Garbhasha, Shodhan, Vedna, Stavan, all kind of drugs should be there. The specific mention is there for the birth attendants. A lot of properties are mentioned in Ayurvedic literature, how the birth attendant should be. And nowadays, according to the WHO, Dai and family member is very mandatory to stay along with the laboring woman. That kind of thing is, I think, they get inspired from the importance of birth attendants. That is mentioned in Ayurvedic literature also. So a lot of features are there. So Bhausha Prajata, multiparous woman. So Hardayukta, having good heart. Satat Anurakta, continuously busy in service. Pradakshina Chahara, possessing strong character. Pratipatti Kushla, experienced in conducting labor. Prakriti Vatsala, with basically affectionate in nature. Tyakt Vishada means free from grief. Klesh Sahishno, having good tolerance. Ashtang Sangrahkar mentioned specific characteristic like Krit Nakha, means with trimmed nails, because they are going to help the woman during the process of parturition. So the nails should not be long. And Prajanan Kushla, expert in conducting deliberate. And Priyadarshana, well behaved, wearing good clothes and having a good character. Arundat mentioned a specific word like Sutika Parivarita. So what is written about the Sutika Parivarita? Sutika Parivarita anek baar prasava anubhuta tatkalochit vyavhar kushala bhi istri bhi parivarita. So Sutika Parivarita means experienced in many labor. So number of attendants in Charak Sanhitakar is Striyascha Bhavyo Bahusha. A lot of females or birth attendants should be there along with the pregnant female. Chatrasa Istriya. So minimum number is 4. That is mentioned by Sushruta Sanhitakar. 4 birth attendants should be there. So continuous support of a woman during labor creates a strong feeling of security and satisfaction and is associated with reduction in the length of labor. The women have above mentioned qualities should encourage the Garbhani by counseling and pleasant words and should educate the woman when and how to bear down. So according to Charak, Sushrut, Vaghat, Kashyap, On ensuring the onset of labor, woman is given massage with oil followed by bath with cushion gel. So that is also mentioned. That is the paricharya. So what should be given for the nutritional purpose? Akantha yavagu in the early phase of the labor, and Sagrita yavagu mentioned by Ashtanga Sahitakar, or Sagrit Peya, Lagu, that is Lagu Pachak Vatanuloma, Dhatu Pushtikar, Krishna Shamak, and Glani Hardation. So that kind of the liquid diet is mentioned by all the acharyas during the process of labor. So Yavagu is rich in carbohydrates, so it will provide instant energy to the female. At the time, glucose or other crystalloids were not available. So by the oral route, the supplementation of the nutrition is required. It is easily digestible and refreshing. Its intake is advised in early stage of labor. It also has property like Deepan, Balle, and Path Shamuk. In Kashyap Sahitakar, use of mastras for non-vegetarian females. The mastras is also mentioned. It's rich in amino acids and all the trace elements. So that's why that is mentioned. It's quite nutritious. So what instruction should be given to the patient or the laboring woman to bear down during Gavi Agman, only at the bear down only during the 2 labor pains, or during the labor pain, or to bear down slowly at the start and not to bear down in absence of Gavi. That should be indicated according to the Ayurveda. A lot of defects may appear. That is written in Ayurvedic text due to Akal Pravahan. So very much importance is given to the bearing down efforts also, because there is visheshan of Vadosh due to Akal Pravahan. So bearing down effect in absence of contraction leads to prolonged labor or obstructed labor, which ultimately result in Mukh, Kubj, Kas, Shwas, Yukta Jwar, etc. So Yukta Jwar maybe when there is prolonged labor and the woman keep on bearing down, even in the absence of the uterine contractions, that will cause fetal distress. So that kind of abnormalities may appear in that fetus after the delivery, and there may be infection due to the repeated vaginal examinations or due to prolonged labor. So Karnini Unipep, that is the complication we all know in the maternal complication that is mentioned in Ayurvedic texts, specifically in Charak Chikitsa 30. So that may appear in the later stage. So in the modern context, fetal hypoxia, fetal distress, formation of caput succedorum, dehydration, ketoacidosis due to the production of lactic acid in the woman, uterine inertia and prolapse, that is the remote complication of the Akal Pravahan. So circumcision position, women should sit on a soft cushion spread over the ground and advised to lay down on bed in late phase of second stage of labor. That is mentioned by Charak Sahitakar. And when there is Avi start, she should sleep in supine position with flexed thighs on soft bed having pillow. That is mentioned by Sushru Sahitakar. Ashtanga Sahitakar mentioned soft bed covered with skin of Rakta Rishabh. That is a kind of making douche that is used nowadays, because at that time the skin is used because it is going to prevent the spoiling of women cloths due to the drainage of liquor amni or due to the discharges from the vagina. So what position should be there? Bhugna Sakti Uttanam. Uttan position is mentioned for the delivery according to Sushru Sahitakar. That is near to the lithotomy position of today's era. So other positions sometimes used in modern practice like lateral squatting, but the most popular position is lithotomy position, dorsal position with 15-degree left lateral tilt. That is advisable nowadays, and that is quite near to the position mentioned in Ayurvedic texts. A specific chikitsa, that is mantra chikitsa, is also mentioned in Ayurvedic text. That is going to prepare the parturient woman for the process of labor and create a serenity in the labor room, a good environment in the labor room that will enhance the production of good hormones, or that is going to help the woman to undergo sukh prasav or normal delivery. So it is considered under Davi Prashya Chikitsa. So mantra described for prasav is Chavan mantra, specifically mentioned for that. So Chavan means fall, referring to the expulsion of fetus. So Ashtanga Hridayakar mentioned Prithvi, Jal, Akash, Tej, Vayu, Vishnu, and Prajapati. should protect you, the woman carrying the fetus, and make you free from the affliction. So, what would be the mode of action of mantra chikitsa? The effect of mantra is prabhavjanya. We can say that is prabhavjanya action is there. So, mantra is composed of, according to the recent researches, by certain letters arranged in a definite sequence of sounds. So, sound and music are form of vibrational energy, which can have a significant impact on living organisms. The individual letters of Sanskrit alphabet are derived from basic strands of energy vibrating at the central part of existence of human beings. And these vibrations created by sound, thought, and actions really do have an impact on inner self of human beings as well as on the environment and hence the universe. So recent researches in the efficiency of mantras according to modern science also, the hormones and neurotransmitters throughout the human organism communicate with each other through the distinctive vibration. That kind of research is there. So it will help in the normal synthesis of hormones and neurotransmitters that are required in the process of labor. So now I am going to discuss two of my clinical research works done by PG scholars in our department. One is by Dr. Ritu Dhiman, a clinical study of Sukh Prasav Kar Lev on Prasav Vedana. So aims and objectives to study the effect of Sukh Prasav Kar Lev on the pattern of uterine contractions and on the progress of labor. I have described these studies in a very I think concise form because it's a total research work, a complete research work. So I cannot present in that short tenure all the details and minorities of the study, but is important to communicate that I have incorporated in these slides. So inclusion criteria, the major inclusion criteria, the pregnant women under labor were randomly selected for the trial with the age group between 20 to 30 years. Patients having etiquette pelvis, borderline pelvis with cephalic presentation. Exclusion criteria, patient having CPT, wall presentations with history of precipitate labor, cesarean section, bad obstetric history, preeclampsia, polyhydramnios, etc. These kind of complications, if were present in the previous delivery, then we excluded those patients. Patients having systemic disease like diabetes mellitus, hypertension, tuberculosis, jaundice, heart disease, etc., that were excluded from the study. This was single group study. So here the Sukh Prasav Kar Lev was applied on the navi of the woman in first stage of labor, that is in the active phase, and was kept till the delivery of the placenta. And total 50 pregnant females were registered for the trial. So ingredients, or I can say the reference was taken from the Yog Ratnakar Rog Chikitsa, and it is also mentioned in Bhav Prakash Chikitsa Sthan 70, 1/109, shlok number. So Krishna vacha cha api jalen pishta sa arand tela khalu nabhi lepa. So that reference was taken. So here we took Piplimul Churan 25 gram, vacha Churan 25 gram, and arand snake 12 ml. So method of application was Sukh Prasav Kar Lev is applied externally around nabhi on abdomen in about 1/4 part of Angul Praman, that is 5 mm thickness, and it was to be repeated after drying. Or made after the first application, 4 hours after the first application of the labor. So duration from first stage of labor that we applied it in the active phase until the delivery of placenta. At that time, active phase was mentioned from the 3 to 4 centimeter dilatation, but now the WHO recommendation is that we should consider the active stage from the 5 to 6 centimeter, and the deadline that is 5 centimeter. In the new edition of books, we can get that kind of change, and the partograph is also changed, and we have to put the partograph or fill the partograph after the 5 centimeter of dilatation, as it was before. The 2 lines were there, action line and that kind of lines were there, but nowadays that lines were removed. And the duration is mentioned in the partograph that for the 5 centimeter of dilatation, like 5 or 6 hours, if the patient stays on at that kind of dilatation for up to 5 to 6 hours without any undue complication or fetal distress, then we should wait until that. And likewise, at 6 centimeter, we can wait for few hours. Then for 7 centimeter, we should observe for few hours. So we should not go for the cesarean section. Just to curtail the cesarean section rate, the WHO has changed the partograph. a lot of changes there, but I think now it is not in practice at all the places. We are still using the simplified partograph available in our hospital. Still we are using that. So here the partograph was filled according to the simplified part. So duration from first stage of labor, active phase till the delivery of placenta, that was mentioned, and root externally on the skin. So how we prepared that lab? 50 gram of dry powder of sukh prasab kar lab, that is 25 gram pipli mool churn and 25 gram vacha churn. That was taken and kept in a bowl, and a small amount of hot water and about 12 ml of Eredus Snehi was mixed well with the churn dravyas. And it is kept for the 15 minutes so that the oil is soaked with the powder. And now that paste was became soft, and it was ready for the application after softening. So position of the patient for application of labor, the patient is made to lie on her back with arms by her sides on a firm mattress. The head and neck should be supported by pillow to make her comfortable. So how we applied it? The doctor should stand to the right side of the patient. Abdomen is exposed up to ZP sternum. Clean the abdomen with a hot water swab before applying the lab and allow it to dry. Lab should be again mixed well. Prepared lab is applied starting from the umbilicus and on the umbilicus up to the radius of 6 centimeter approximately with the help of Mongolian steel spatula. After applying, it should be leveled properly. The lab should cover with plastic sheet to avoid spilling. The patient is kept in position for 15 minutes, then allowed to move. We're still using this practice because we have established its clinical importance by this research work. So we are still applying this lab to our laboring patients in the labor room. So this is the picture showing the application of lab around the umbilicus of the full-term female in the active phase of labor, and it is covered with a sheet. Now, criteria for assessment. Here we consider duration of all 3 stages of labor that are compared with the standard mean duration of first stage, like or we can say for active phase. So it is 5.58 hours, second stage 57 minutes, standard mean duration, third stage is 50 minutes. So we adopted scoring method for that. So mode of delivery and was considered. Whether augmentation required to that patient, that was considered. Fetal heart rate, any PPH, partograph. So on the basis of assessment criteria, following grades were given to all the assessment criteria parameters, and so that we can derive cumulative result. Here we put emphasis on pattern of uterine contraction or pain threshold by verbal rating scale. So what we got, effect of therapy on intensity of pain. The maximum number of patients, 52% patient felt moderate pain during uterine contraction, though the contractions were strong, but the feeling of pain was moderate in maximum number of patients. After that, mild pain was felt by 34% patients and severe pain by 14% of the patients. So duration of stages of labor. The standard mean duration of first stage was 5.8 hours, but it was found in trial group 4.89, and the results were highly significant as p-value was less than 0.001. And for the second stage, standard mean duration is 57 minutes, and we got 37.04 minutes in average in all the patients. So it was highly significant on p-value. And third stage, 15 minutes is the standard mean duration, and we got 5.24 minutes. And there is p-value less than 0.001. That is highly significant. So overall results on the basis of rate, 92% patients fell into grade 1 and 8% in the grade 2. So what could be the probable mode of action of the drugs? So drugs that are locally applied are absorbed in a systemic circulation, as we all know. So hence they have local as well as general action in the body. So primary barrier to the absorption of exogenous substance through the skin is stratum corneum. So passage through this outermost layer marks the rate limiting step for percutaneous absorption. So major steps for percutaneous absorption include establishment of concentration gradient, release of drug from vehicle into the skin, and diffusion across layers of skin. So physiological factors that affect percutaneous absorption include hydration, occlusion, age, temperature, and anatomic site. So occlusion of skin with wraps of impermeable film or occlusive medicine itself prevents loss of water from the skin. Since water is absorbed readily by protein component of skin, the wraps of impermeable film greatly increases the level of hydration in the stratum corneum. So the lap is covered with impermeable film, and the concomitant swelling of corneal layer extensively decreases protein network density and the drug diffusion path. So vehicle chosen for a topical medication will greatly influence the drug absorption. And the fat-soluble fractions of drug should be administered in the form of fatty preparations. So here, Erantel was used as a vehicle, fatty vehicle. So once the transepidermal penetration has occurred, the continued diffusion of drug into the dermis is likely to result in drug transfer to the microchannels of the dermis and then into the general circulation. So supracervical layer is made like a paste in the base of Erantel. So it is more anhydrous and occlusive. The anatomical structure for absorption is abdominal skin around the umbilicus. So as we know, the internal iliac artery supplies to the umbilical artery and to the uterine artery also. So we can get a local action by systemic absorption through, of the drug from the umbilicus. And cutaneous innervation now of both the regions is from T10 and L1, so that is going to help or improve the neurological function. So what could be the properties of Ayurvedic drugs? So here Vacha was used. So it is having oxytocin-like property and it contracts uterus. Pipili and Erantel both have uterine contractile activity. So going to contract the uterus. Vacha and Erantel and having antispasmodic analgesic effect also. So it relaxes the uterus in between the contractions and relieves the pain or the sensation of pain. That is just hypothesis derived from the properties of the drugs. So Vacha is also having sedative action. It is proven it's a sedative action it is having. So it relaxes the patient also by systemic absorption, and Pipili acts like counter irritant. So it relieves the pain. In this study, we can use the drug preparation methods of today's world, because nowadays we all know the nanotechnology is available that is going to enhance the absorption of the topical liniments. So if we try or if we are permitted to do that kind of research, so we can make these kind of the preparations, topical preparation to apply around the umbilicus just by using those technologies that will further enhance the absorption of the drug. And definitely we, in these preparations, we will use the aqueous extract. So that will further enhance the main function that what is required, that is to contract the uterus or just to relieve the spasm in between the contraction or relieve the spasm of the cervix so that it will dilate smoothly. So that kind of thing we can just do in future. So that we should pay heed on that kind of use of latest researches.
Yeah.
And the second study, a study to evaluate the effect of Anuvasan Basti and Pichu in advanced pregnancy in phenomenon of labor. It was done by Dr. Sheetal Minhas in our department. So here the inclusion patient criteria, the pregnant women between 30 to 35 weeks were randomly selected for the trial with the age group between 20 to 35 years, irrespective of gravidity. As preferably, we advocated the medicine to the primigran. So patients having adequate pelvis, borderline or pelvis with cephalic presentations were included in the study. So patients having CPT, small presentations, contracted pelvis, history of APH and prostate labor that were excluded. Patients having systemic diseases like diabetes, hypertension, heart diseases were excluded. Patients with obstetric complications like IUG or polyhydramnios, etc. So what we did in this study, here we use drug Balyamtal that name was given by us to that cell. Otherwise, in Ayurvedic text, in Garbhani Paricharya, in the 9th month, Charak has mentioned the Madhur Aushad Sadhit Anuvasan Basti, that is mentioned, and Pichu of the same oil. That kind of, as everyone knows that thing. So that is mentioned there. So here we use 12 parts of Murchit Til Tel and 1 part each of Shali Parni. From the Madhur Gan, we selected the drugs Shali Parni, Bala and Pitari that were taken, and Talpak was done by following standard Talpak Vidhi. So mode of administration, the patient were randomly divided into 2 groups here. So first group was trial group. The patient were given Matra Basti, 60 ml of Ballamtal twice weekly after registration, and Pichu soaked with Ballamtal daily till the onset of labor pains. In control group, patients are kept under observation without the use of Panvasan Basti and Pichu. And at the time of labor, we use the standard protocol advisable as per the modern guidelines. So here we registered total 60 patients, out of which 27 patients completed the trial in trial group and 30 patients in the control. So incidence of rupture of membranes in both the groups was observed. In group 1, that is the trial group, 0% in pre-labor rupture of membranes were observed in 0% patients, and in group 2, in the control group, 60% patients undergo pre-labor rupture of the membranes, and 100% patient had rupture of membranes at the time of labor in the trial group as compared to the 40% in the control group. So intensity of pain felt during the labor. So in trial group, 85.18% patients felt moderate pain during the process of labor, and in control group, 46.15% patients felt moderate pain, while 14.8% felt severe pain, and while 53.84% in the control group felt severe pain. So nature of labor in trial group, 100% patient undergo spontaneous onset of labor, while in control group, 19 patients or 63.33% patient undergo spontaneous onset, and induction was done in 36.66% patient in control group, while in 0% patient in trial group. So type of delivery, 74.1% patient undergo normal delivery in trial group as compared to the 0% patient in control groups. So episiotomy was given to the 25.9% patient in trial group and 66.6% patient in control group. Forceps delivery was none, analysis was none in the trial group, while 6 patients or 20% patients in control group undergo forceps delivery, and 13.3% patient undergo LSCs. So duration of stages of labor in trial group in 27 patients who completed the study. The mean duration of stage 1, 13 hours, 18 minutes. And in all the patients, the standard mean duration in trial group 9 hours and 53 minutes. And it is highly significant on p-value. In stage 2, there is 57 minutes as per the standard mean duration, and 34 minutes was observed in the trial group as a standard mean duration in all the patients, and it is highly significant on p-value. In stage 3, the 15 minutes is the normal mean duration, while in trial group it was observed 2.4 minutes. That is also highly significant on p-value. Now, duration of stages of labor in group control group, as we noticed only in 26 patients, because 4 undergone LSCs in that group. So in stage 1, the mean duration was 14 hours 53 minutes in control group as compared to 13 hours 18 minutes is the standard mean duration. That is non-significant. It is 57 minutes as standard mean duration, and it was noticed 1 hour 2 minutes in the control group. And in the stage 3, that the 15 minutes in normal mean duration, and it is 4.2 minutes noticed in the control group. So on intergroup comparison, In the duration of first stage, we got significant results as per p-value, that is less than 0.01. And for the second stage on intergroup comparison, that is non-significant because the p-value is greater than 0.05. And for the duration of the third stage on intergroup comparison, that is highly significant because it is less than 0.001. The grading was done as I have previously mentioned in the previous study, so I didn't mention it in this study again. So the grade, the patients, 74.1% patient in the trial group fell into the grade 1 and 25.9% in grade 2, as compared to the control group, where 26.6% fell into the grade 2, 40% in the grade 3, and 33.3% in grade 4. So what could be the probable mode of action of the drugs? The cumulative effect of the drugs of Balyamtal is Balya Brahaniya, Rasayan or Bal. As Bala, Vidari, and Shaliparni, the drugs selected are having Madhuras and Madhur Vipak, therefore strengthen the muscles of the Bhasha and bone. And Dravyas being Vedna Sthapan and Anuloman acts as a Shul Prashavan also. So due to the Sniktakun, Pradhanta elevates the Sthanik Rukshata. And there is Anulom of the Apan Vayu. So Ayurvedic view, according to that, the properties of the drugs are Vedna Sthapak, Deepan, Mutra, Rasayan, Anuloman, Kremik, Shothar, Snehan, Brihani, Balle, Pachan, and we can say it is general tonic, antioxidant, analgesic, anti-inflammatory, antimicrobial, diuretic, and lubricant. So mode of action of Basti. So Basti having Snehi Gunu counters the Rukshta in Pakvasha according to the Ayurvedic concept and helps in Anuloman of the Vadosh. Acharya Sushruta mentioned that the virya of Basti spreads all over the body, just as water poured at the root reaches all parts of the tree through the micro and macro channels. Acharya Prasha narrated that Buddha is the main root of the body and contains blood vessels in it. So the Basti administered in the Buddha nourishes all the dhatus and organs of the body and eliminates the vitiated doshas. So modern concept also corroborates the Ayurvedic concept, as rectum has a rich blood and lymph supply and drugs can cross the rectal mucosa like other lipid membranes. Thus unionized and lipid soluble are readily absorbed from the rectum. The drugs absorbed from the lower rectum enters directly into the systemic circulation via middle and inferior hemorrhoidal veins. So the effect of the Basti can be seen all over them. So it bypasses the liver metabolism. So that's why the local administration of the drugs is going to give the better results. So mode of action of Pichu. So Pichu makes the perineal muscle soft and smooth. It lubricates the entire vaginal canal due to its uncontestedness and thus prevents unnecessary friction. And oil of Pichu has antimicrobial properties, so destroys pathogenic bacteria of the vaginal canal. It helps in softening of the vaginal canal, of the cervix also, because application of the Madhurosha Sadit oil at that above on the cervix is going to ripen the cervix. So that's why there is Sukh Prasad. So Pichu application can initiate perfusion reflex also, because we have to apply the Pichu locally daily. So due to the dilatation of vagina, that initiates the labor at time by the perfusion reflex. Thank you. Thank you so much. Dr. Rajeshwari, over to you.
Yes. Thank you so much, madam, for this very wonderful and very informative session. Thank you so much, madam.
Most welcome.
Now, I would like to invite Dr. Brunali Gharpure to please take question and answer session.
Thank you, Rajeshwari ma'am. Good evening to everyone. Myself, Dr. Brunali Gharpure. I would like to thank Dr. Soni Kapil ma'am for enlightening us with her commendable talk on this subject and clearing our concept. Now, I request to the participants, if they have any questions, then please raise your hand and put your questions in the chat box.
Hello, madam.
Sir.
Yes, sir.
Namaste, Soni madam.
Namaskar, sir.
Oh, thank you so much for your valuable time. Actually, am I audible?
Yeah, of course.
Okay. I want to ask one question on behalf of Dr. Priyanka madam.
Okay.
Ma'am, want to know, can you elaborate the research that has happened about Ayurvedic drugs that work in induction and the augmentation of labor?
Yeah, induction for the induction of labor, we are using castor oil basti in the patient. But I observed that it is going to give result when there is favorable Bishop score. So if the cervix is not favorable, as we can say for the prostaglandin induction, like Serviprime, these jellies are available nowadays. So we can say that it is going to give the equivalent result in a favorable with the favorable Bishop score, but not as equal to the Serviprime sometimes. But we also observed that there is failure of Serviprime jelly introduction into intracervically or into the posterior fornix. Sometimes we have to induce repeatedly, and sometimes even after repeated application, that is not going to give the desirable effect. So basically it depends upon the Bishop score. So the same kind of thing we are getting by giving the Anuvasan Basti of Erandasane, though a lot of research works are available for the oral administration of the Erand Snehi for the induction of labor, because it is going to cause the release of prostaglandins. So that kind of research is available, but I am doing, maybe other people are also doing the same thing. So I tried the Basti of that drug because it is going to give the better results. And I observed that we got results for the induction of labor.
Okay, ma'am. Actually, while choosing the method of induction or the choice of induction, what is the criteria, ma'am? And for which patient you are going to try the Ayurvedic drugs as an inducing agent?
We usually prefer the Ayurvedic drugs.
Okay.
Recently, we tried the Asthapan Basti, that is specifically mentioned. I cannot give you the details of the drugs because I am not remembering that what are the contents of that drug. But Vagbhat has mentioned the same treatment for the Aparapatan and for the for the prolonged labor.
Prolonged labor. Yeah.
Yeah. So for the augmentation of labor, when we tried it in few patients when there is prolonged first stage, and we observed that by waiting for 12 to 14 hours, the uterine contractions are not going to subside, and there is not desirable score of the cervix we are going to achieve even after observation for this prolonged period. Then we give the Asthapan Basti of that drugs. A lot of some Shodhan kind of drugs are there in that Basti also. So that gave us a good result.
That you are using intrapartum period if there is a delay labor.
Yeah, not in the active phase. In that phase we didn't use, but in that we can say in the first stage of labor, but in the latent phase. And if it is prolonged and the contractions are not, though the WHO guidelines are like that we should not intervene in that period, but that guidelines ever changes, so we can use our drugs in that period, because we cannot equal them with the modern available drugs like oxytocin and prostaglandins. So we can help the patient by using these drugs or trying these drugs in those patients. And Dhoom Naste also I have tried. A lot of research work were done on the Pushtela Adi Pradhaman, that is mentioned. Yeah, so I think we should keep it for the in series. I can discuss those research work also if I will get opportunity at your platform. So in detail, but we also tried that in study. And Dhoom Naste for Bhujpatra or Guggul, that is also used in a few patients, but not in a clinical study, in few patients for the trial basis, because we are still experimenting on the patients by giving these trials to the students. And definitely I will come forward after some time with good results from these clinical trials to share with you.
Okay, okay. Thank you, ma'am. Dr. Priyanka, ma'am, also want to know how this drugs act
You
on
don't want to
different-
know anything. Just Dr. Priyanka
No,
ma'am.
no. My questions are coming afterward. I just want to cover these 2
You are
points.
going to grill me for a longer period.
No, 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 ma'am. Actually,
Carry on. I'm just joking.
yes. Ma'am actually want to know how these drugs act on different pathways of the inflammation involved in cervical ripening or the receptor sensitization of the prostaglandins of oxytocin.
How these drugs act like that?
What is the pathway of the?
Yeah, the same pathway that is mentioned in the modern texts, but
Okay.
just we are giving the oil-based drugs, or if we apply the pichu, then just by hydrating that area. But what is the collagenase act? I think you know as per the modern text that the collagenase act in the pre-labor
Yeah,
phase.
yeah.
So we are just supplementing these changes by providing our drugs to that area or applying those drugs to that area. Because a lot of phytoestrogenic activity is also there in the components of the oil. So estrogen is, as we know that is also required. The high level of estrogen is required for the onset of labor or for the initiation of the changes. So when we provide it in a low dose, or we can say like chronic poisoning, or we can say like that. So we are not just providing the estrogen, but due to the phytoestrogenic activity, it's just in a cumulative effect, we will get this in a later on period.
Okay,
We
ma'am.
keep on applying.
Okay, now I will start.
It is just a hypothesis just because a lot of research work at a higher level is required, and we are not having that kind of facilities to research our drugs. Maybe the CCRS or other research institutes are doing in this direction also. But still I feel that in the field of the obstetrics, that kind of research is the need of era, and we are still not getting that kind of amenities to prove our drugs and
Yes.
mode of action of those drugs. Just we can postulate the hypothesis as per the guidelines of the modern texts.
Okay, ma'am. Now I will ask some of my questions, if you permit.
Yeah, of course.
Actually, in the today's era, we have the better options like oxytocin, prostaglandins. Then
Yeah.
why there is a need to develop a new Ayurvedic drug? What is the
Just-
extra benefit we can achieve from our drugs?
Because it is natural. And nowadays, oxytocin is not freely available because a license is required to keep that drug. It is just we can say the restricted drug. In our state, I don't know about the scenario in the whole India, but that is restricted drug, and we have to give the details of where we have used it. Though we are allowed to practice modern drugs also in our state, but still we that is prohibited for the modern practitioners also. Now they are also promoting that these kind of drugs should not be used very easily, or we can say very frequently. We should use it meticulously where it is usually we require it in dire circumstances. So but that kind of prohibition is not there if we get that kind of alternative for where in those states where the modern drug practice is not allowed.
Okay.
So those people or Ayurvedic people can use these drugs for the induction and augmentation of labor. Now the newer guidelines are like that we should wait for a prolonged period and don't go for the cesarean section until there is fetal distress, meconium chain like maternal distress, or that kind of thing is there happen. Then you should opt for the cesarean. That kind of guidelines are there in provided by WHO, but they are not having any other replacement for the oxytocin. So we can also help by providing the natural alternative for the enhancement or augmentation of labor, or that is not going to harm the physiology of or process of labor. So that we can do from our side, and it will make us independent. We need not to rely upon their drugs, as they are also curtailing the practice of their own drugs. So that is the additional benefit we will get if we will research on our basic concepts.
Okay, ma'am. I think there are some challenges for the drug development. Like we cannot calculate the dose of our medicine. We cannot titrate the dose. At once we applied a lab on the abdomen, it may be different for the different ladies.
Yeah.
Okay.
I
Or
agree.
once we applied the lab, and if there is hyperstimulation, then what can we do? I think there are some challenges for us. What do you?
Yeah, but I never noticed we have tried this drug, but we're still practicing that kind of thing. We never noticed that there would be hyperexcitation, and if the labor is progressing normally, then it should not be a routine practice to apply that.
Yeah, that is
lab.
the point.
That should not be a routine practice. We use it when we require certain kind of enhancement, and we
Augmentation. Okay.
just do it for the augmentation of labor whenever we are not just willing to use the oxytocin, or because we usually prefer to give the oxytocin at the full dilatation or at the time of just the expulsion of baby, just to prevent the postpartum hemorrhage. So we usually prefer to use oxytocin. Sometimes if that is not required, we omit that kind of administration also. So,
Okay.
so that should be there. I mean, it should not be a routine practice.
Okay, ma'am. Any questions from the audience? Any questions from audience? Dr. Garpure, any questions?
Hello, ma'am.
Hello.
Ma'am, can you tell diet for full-term pregnant women for Sukha-Prasava?
So, Prasav, from the dietary point of view, the drugs that induce or that can enhance the uterine contractility, the dietary articles like ananas can be used, dates can be used, and papaya can be used. And along with that, highly nutritious diet is required, because the strength and stamina is required for the laboring woman. So at the time of onset of labor or just before the onset of labor, that can be used. A good healthy diet with a lot of protein-rich diet that can be used. And I have already described the protein like Peya, Yavagu, that is going to provide the strength and stamina. I have already described in my presentation also. That is mentioned in Ayurvedic text.
Thank you,
Actually,
ma'am.
ma'am, there is a common practice when patient came in a labor. We generally advised to keep an NBM. In the clinical practice, when patient came in a labor, we advised to stay NBM.
Okay.
And in our literature, we said we have to give Yavagu Ban and that all.
That should be given in the first stage, I think, in the early first stage.
Okay.
When the patient can assimilate that, because in that period, augmentation was not done. So patient remained in labor for the prolonged period. So the strength and stamina is required. Until she entered into the active phase, we can give these kind of drugs still in the present era.
Okay.
There are these kind of articles we can give.
Okay, ma'am. Dr. Arpita?
Yes, sir.
You want to...
Yes. Good evening, ma'am.
Good
Ma'am,
evening.
first of all, thank you for this session. It was a really wonderful session. I just wanted to know one thing, that like you've mentioned that the lap which was applied, you can repeat it after every 4 hours, and you covered it with a plastic film. Like you have used, but in lap, vidhi, they mention that if the lap gets dried, the action increases. I mean, due to the dryness, the skin gets pulled, and the ingredients also work better. So can we use a dry lap or the moist lap is to be used? I mean, have you tried it both the ways? I just wanted to know.
Because it is oil based, so I think it is not going to dry so easily. It will take a lot of time, and because of oil based, and that's why we put a film over it, just for the prevent the spilling also. And according to the modern literature, I have described the mode of action of application of these kind of topical things or around them, like So the answer is I have already described to you.
Yes, ma'am. That is there, that the oil base and that will act as a vehicle, and that all is correct. I just wanted to know regarding the wet and the dry lip. Will that make a difference? It was just a query from us, ma'am.
Because that kind of thing is not mentioned, that in laboring patient, it is not mentioned in Ayurvedic text at that place where this lip is mentioned. But you can take a standard practice, but the purpose of action is different in that kind of. The Varnekar lip and that kind of lips are mentioned, and the purpose of action is different. So we cannot equate it with the laboring woman. So it's
True,
just a
ma'am.
trial, and you can try it like that also. If you get better results, then we can apply it accordingly.
Yes. Thank you so much, ma'am. Yeah.
Okay.
Madam
Hello,
Dr.
ma'am.
Vivek.
Uh,
बोला. Garpur
Ma'am,
ma'am.
hello. Ma'am, can you share your some experiences where Ayurvedic management is better than modern?
we cannot say that up to what we have researched, we cannot equate with it with modern management, because now the things are very much advanced, but we can curtail the use of modern drugs for a normally laboring woman. But where emergency arises, we have to take the help of the modern amenities and modern drugs and modern procedures, specifically like severe infection. We cannot deliver every patient normally by using our drugs. This is my practical experience. So support from the modern side is always required, or maybe we are permitted to do those kind of procedures like severe section, then we can handle by the blend of modern and Ayurveda the patients. We can cater the patients in a better way by blending both the pathies. It's my opinion.
Thank you, ma'am.
Actually, I think I have taken all the time.
Ma'am, just a minute.
Still any query is there?
Dr. Vivek want to know about the animal studies.
No, because we are not having the animal house with our institution. We have to rely upon the veterinary or CSI, or these research institutes are there in our neighboring place at the Palampur. So the animal studies, it is not possible for our students to devote that much time and go at another institute to do these kind of animal studies. But definitely the Dravya Gun people are doing that kind of animal studies on different drugs. But that is, I think, not the part of my research work, so I cannot share that kind of data with you.
Any
Thank you,
questions?
ma'am. Any questions? Ma'am, lastly, it's humble request from our side. If any questions are which are remaining, if you would like to take it on WhatsApp group, it would be definitely enrich our knowledge. Please, ma'am.
Yeah, of course, I will try my best. I will try to take out time from my schedule to discuss with you on WhatsApp also.
Thank you, ma'am.
Thank you so much.
Now,
Thank you so much.
now we will proceed with the vote of thanks. It's my privilege to deliver the vote of thanks for this webinar. On behalf of NIMA-OBGY Society Central and NIMA-OBGY Society Maharashtra Body, I would like to express my gratitude to NIMA Central President Dr. Ashutosh Kulkarni sir, Secretary Dr. U.S. Pandey sir, and Treasurer Dr. Shantilal Sharma sir for their support. I extend my gratitude to our NIMA-OBGY Central President Dr. Kamini Dhiman ma'am, Secretary Dr. Priyanka Nakare ma'am, Treasurer Dr. Vishnu Bhavane sir, and Convener Dr. Rajesh Utane sir for supporting and guiding us to conduct this webinar. I would also like to thank and extend my gratitude to our eminent speaker, Dr. Soni Kapil ma'am, who took time from her busy schedule and delivered such a wonderful session. Thank you so much, ma'am. I would further like to extend my gratitude to our NIMA-OBGY Maharashtra President Dr. Suhas Herlekar sir, Secretary Dr. Manoj Gaikwad sir, and Treasurer Dr. Ajay Raj Bal sir for their guidance and support. I would like to thank you Dr. Girish Daga sir, Dr. Vivek Jogi sir, and Dr. Umesh Lunawat sir for their support and technical help. Now, last but not the least, I would like to thank all the delegates for their participation and cooperation in making this webinar successful. Thanks to all. Now, with the due permission of the all dignitaries, I am concluding today's webinar.
Madam,
Thank you,
so,
everyone.
Soni madam,
Sir.
actually, once again, thank you from my side. You told my questions.
Most welcome, sir.
Okay, I'm very thankful for your precious time you have given for the enrichment and the upliftment of our knowledge of our graduates, which is one of the great objective of our NIMA-National Society. So once again, on behalf of NIMA-National Central and the Maharashtra branch, and thank you so much for your valuable time. And we
Thank
need
you
a
so much, sir, for
continuous
providing
support.
me this great opportunity. Thank you so much.
Okay, ma'am. Okay, we need a continuous support from you also.
Okay, okay.
Thank you.
Thank you, sir.
Thank you all for attending and hope you have learned and gained great knowledge from Dr. Kapil ma'am. Thank you.